Why does going to the doctor so often feel rushed, impersonal, and frustrating? You wait weeks for an appointment, sit in the lobby, and then finally get seen, only to have the visit end just as things start to matter. What if it didn't have to feel that way? My name is Janet Kiss, and I've been a membership expert at PartnerMD for over 13 years. At PartnerMD, we've spent over 20 years helping adults explore whether concierge medicine is the right fit for their health needs. Today, I'm going to walk you through the top 5 pros and cons of concierge medicine, so you have a clear, honest picture of what this model offers, where it may fall short, and whether it makes sense for you. Let's start with the pros. Pro number 1, longer appointments and stronger doctor relationships. Concierge physicians typically care for 400 to 500 patients, compared to the 2,000 or more common in traditional primary care. That smaller panel means appointments that last 30 minutes or longer, feel focused rather than rushed, and build towards something real over time.
The longer appointment times that you receive here at PartnerMD, you don't feel rushed and you have less tendency to forget something that you meant to say to your doctor. And it also allows them to ask you more questions and get more details about what your issues are. And I think they're able to come to a conclusion better about what they can do to help you because they have more information.
That continually allows your doctor to recognize patterns, follow up proactively, and address concerns before they become bigger issues. Your physician gets to know not just your chart, but you. Pro number 2, faster access to care when symptoms arise. Most concierge practices offer same-day or next-day sick visits, and schedules are designed to start on time. For most patients in traditional care, that's simply not the experience.
My husband was extremely ill. We left the emergency room and they were like, "You need to see your doctor immediately." They insisted that the first appointment that we could get was 3 weeks out.
Faster access means you can address concerns early when symptoms first appear, rather than waiting until something minor becomes serious. That's what same-day care is actually for. Pro number 3, 24/7 communication with a physician. Concierge medicine extends access beyond traditional office hours. You can reach a physician by phone at night, weekends, or early in the morning. That kind of access isn't just convenient, it provides real guidance when questions arise and clarity when symptoms feel uncertain. Being able to speak with a doctor who already knows your health history, not an anonymous after-hours line, helps you make informed decisions without unnecessary stress or a trip to urgent care or the ER. Pro number 4, proactive health coaching and advanced testing. Some concierge practices go beyond traditional primary care to include health coaching and personalized wellness programs focused on prevention, performance, and longevity. At PartnerMD, that means working with certified health coaches on nutrition, stress, sleep, and fitness, alongside advanced screenings designed to detect early signs of chronic illness.
Health coaching takes care of all the non-pharmaceutical interventions, and that means your lifestyle. Most of our illnesses and disease and chronic disease are linked up with lifestyles. Your health coach take care of, sleep health, physical activity, exercise as something different from that, dietary patterns. We work in continuous communication with your doctor, so we enter notes in your medical chart, we read their notes, we see your blood work results. So the idea is that you are in the hands of a clinical team.
Forward-looking care helps you stay ahead of health risks and build long-term habits, with a team that's involved in the full picture, not just what happens inside the exam room. Pro number 5, coordinated specialist referrals with physician oversight. Concierge physicians take an active role in coordinating care across specialists, such as cardiologists or endocrinologists and diagnostic services. They manage referrals, share records, and ensure communication stays clear between providers. With one physician overseeing the broader picture, care decisions are better aligned and less fragmented.
Biggest thing that I continually face with my patients is that they are either dismissed by a specialist or the description of what they're dealing with from the specialist was not clear to them. It was on a level that took 11 and 12 years of training to understand, and they get it in 5 minutes. So bringing it all back down, kind of trying to wrap it up and help them understand what they've been dealing with and kind of, in this case, maybe what the specialist said to them and what that plan would be. And I like that can leave us some confidence in what is going on with them.
When someone is actively coordinating your care, not leaving you to track referrals and repeat your history at every visit, the difference in outcomes can be significant. So those are the 5 pros. Now, let's be honest about the other side. Concierge medicine isn't the right fit for everyone, and there are real considerations worth understanding before making a decision. Here are the 5 most common cons. Con number 1, membership fees are paid out of pocket. Most concierge practices charge between $2,000 and $5,000 per year per adult. It's paid separately from insurance. This is the biggest consideration for most people, and it's worth being direct about.
I have heard from other friends who had concierge medicine what their fees were, $500, $700 a month, and that's not in my teacher's salary, So I got all the information. I got the fee schedule, monthly fee schedule. They took my insurance, and I thought, for me, this is a no-brainer. I can afford this. If I have to not go for my cup of coffee every morning, it's out, it's budgeted, and I don't even think about it. And it's part of what I do to take care of me and part of my wellness package.
Whether that investment makes sense depends entirely on your priorities and how you engage with your care. It's a real cost, and it's one worth understanding upfront before you make a decision. Con number 2, you still need health insurance. Concierge medicine works alongside health insurance, not instead of it. In most cases, billing looks the same as it would at a traditional primary care office. Covered services go through your insurance, and you're responsible for any co-pays or deductibles. The difference is the membership fee, which supports the enhanced experience, more time with your physician, and a stronger focus on prevention. Con number 3, the model has limited value without regular engagement. Concierge medicine is designed for people who want an ongoing relationship with their physician, not just an annual visit. The added time and access are most valuable when you're using them for prevention, early questions, and meaningful follow-through between appointments. If you tend to delay care or prefer a more hands-off approach, you may not experience the full benefit. This model delivers the greatest return when you use it proactively, not only when something goes wrong. Con number 4, your insurance plan participation may be restricted. Concierge practices differ in which insurance plans they accept. Some do not work with Medicare, TRICARE, or certain carriers. This isn't a reflection of quality, but it does require a conversation before you join. Confirming compatibility upfront helps you understand potential out-of-pocket costs and avoid surprises down the road. Con number 5, availability varies by location. Concierge medicine continues to expand, but it isn't equally available in all areas. Some regions have multiple practices to choose from. Others may have limited options or wait lists. Joining a concierge practice may require flexibility, early planning, or getting on a wait list, depending on where you live. Understanding what's available in your area helps set realistic expectations. So there you have it, 5 genuine pros and 5 real cons of concierge medicine. No sugarcoating. If you value longer visits, faster access, and a physician who has the time to actually know you, it may be worth exploring. If the membership fee, insurance questions, or availability in your area are barriers, those are honest things to weigh. At PartnerMD, we're happy to answer any of those questions directly If you're curious whether concierge medicine is the right fit for you, you can visit us at PartnerMD.com or reach out to our team. We've helped thousands of people make that decision, and we'll be straightforward with you about whether it makes sense or not.